It is with great pleasure that I introduce Jessica Preston to the podium.
So who here, is anyone familiar with functional medicine? Couple, okay, kind of, okay, great. I'm glad you're here to learn about it. How about anyone practicing functional medicine here? So this is great. So we're going to learn something new today, okay? So functional medicine, I found functional medicine about 10 years ago. I work in women's health and I take care of women that are very proactive, they're very engaged, they're very involved in their own care, and they were coming in at younger ages with more symptoms. So they were in their early 20s, their mid-20s, they were getting sick, they were coming in saying, I was just diagnosed with lupus, I have Hashimoto's thyroiditis, and we saw this dramatic change in a short amount of time. It made me think, why is this happening? This doesn't make sense to me. I have a background in biochemistry prior to becoming a physician assistant, and so I kind of fell back on that biochemical background and started thinking about, well, what can we do? What different aspects could we change for these women? And so when they would come in and they've been seen by a couple of physicians or practitioners and they said, you know, everyone says there's nothing they can do, I would say, you want to try something different? Can we just think a little bit outside of the box? And they jumped on it. And so I started making some changes, some lifestyle modifications, some changes in medications or things they could do for supplementation, and they started getting better. And I thought, something's going on here. I need to figure out what it is because I sure don't know what I'm doing. So I started digging deeper and deeper, and I started to find this field of functional medicine. And I found one group called Institute for Functional Medicine, and this is the group that is focused in Cleveland Clinic. And I started going to their trainings, and it was remarkable and life-changing. And so when Lisa Marie asked me to speak with you today, I thought, okay, let's see if I can find some of these little tidbits to give you a little piece of it. I just want you to try to relax and enjoy this a little bit. I am recording this, so you can all watch this again. I'm going to give you access to a site where you can get my slides and another recording of this talk. If you think back and think, what did Jessica say? There was that one little thing. You'll have all of that accessible to you, okay? This is my disclosure. So let's look at our tree here for a moment, okay? And I want you to just take a look at it. We're going to look at the top, and we're going to compare the top, which is our conventional medicine, to the bottom, which is our functional medicine, okay? So when we think about conventional medicine, a patient presents, they have symptoms, we give a diagnosis of disease, and we presume that the disease state is the cause of the symptoms, correct? So now what we do in our functional medicine state is we see these symptoms as predecessors of disease. So this is a different level of prevention. These are your patients who come in and they say, I'm tired, I can't sleep at night, I don't know, something is wrong, but I don't know what it is. They get their diagnostic tests performed, they come back, they find out everything is normal, nothing is in a diagnostic range for disease, and they are told, you are just tired and working. You need to lower your stress life, or it's in your head, right? Okay. So when we talk about functional medicine, what we're talking about is underlying the causes of disease using a systems biology approach, engaging both the patient and the practitioner in a therapeutic relationship. Systems biology. What does that mean? I had to look it up when I was preparing this for you because we're using biology, right? We all have this molecular biology background in order to diagnose disease states, right? So systems biology is a little bit different, where conventional medicine is a reductionism technique where we take our disease state, we take our unilateral focus, and we narrow it down to what are we going to treat, right? And then the patient gets better. Symptoms may or may not be alleviated, but the patient hopefully has those markers that change, correct? So systems biology looks at molecular biology like conventional medicine does, but it also looks at your biochemistry and your biology. It looks at mathematics and physics. It looks at all of those underlying issues under the ground on that previous picture where we saw these roots, where the soil is, all of these components that affect you in a biochemical fashion in order to change whether or not we're going to express these disease states on the top, okay? So that's what we're talking about today. So when we look at functional medicine, we just talked about holism, which is looking at all of those multifactorial aspects. when we're talking about our biochemistry, our mathematical model, our physics, our energy, our atoms, everything that we're looking at for all of that put together to look at our predecessors of disease state. And then we have our conventional medicine, as we already said, with a methodological reductionism approach and where the disease is the cause of the symptoms. So in our conventional medicine treatment, what are we going for? We're going for our normalcy, risk reduction, and homeostasis, right? So what we can do when we're talking about functional medicine is we're going to get to a point where health is robustness, it's adaptation, plasticity, and it's homeodynamics. Wouldn't we all love to live in that state of dynamic health as opposed to just feeling normal? How do we address symptoms? We don't have, we're saying, okay, somebody is fatigued. We know these are not really good for our ICD-10 codes, right? So how are we going to address symptoms when it comes to evidence-based medicine? We know when we look at evidence-based medicine, we're looking at a disease state, what has been proven to work for treatment of this state, and what has not been proven to work. So when we look at evidence-based medicine, this is one trial that looked at 3,000 different diagnoses and their individual treatments. And this was to establish evidence-based clinical practice guidelines. And in this study here, it demonstrated only 11% of those studies showed that the treatments were beneficial. 11% only. This 50% are unknown effectiveness. We can see that our 7% is a trade-off between beneficial and harmful. The green 5% here is unlikely to be beneficial. The yellow is likely to be ineffective and harmful. I already said that. The 24% is likely to be beneficial, okay? So what is this saying about our evidence-based practice? And I think we all find this when we are in our evidence-based model. We must follow evidence-based medicine. So how are we going to continue to do that, whether we're looking conventionally or whether we're looking functionally? So the American Academy of Family Physicians has a new definition, and their new working definition of evidence-based medicine as of September of 2018 is the integration of the best available evidence with clinical expertise and the individual patient's values, preferences, and unique circumstances. Now that's something we can all work within, right? We use our evidence, we get to use our clinical-based practice experience, and we can also take into account the patient's values, which we should have been doing all along, and frankly, we have been. So functional medicine, conventional medicine are very similar. Okay, so they both practice evidence-based medicine. They're both practiced by licensed professionals. They employ advanced diagnostic tests, and they also may use prescription medications. So when we are looking at both and we're comparing and we're trying to utilize which skill set should we use, our conventional medicine skill set or our functional medicine skill set, what we need to do is we need to always look at that acute care because that has to be conventional medicine. Functional medicine is the long game, okay, friends? Long-lasting symptoms, recurrent conditions, and treating chronic problems is where our functional medicine is going to be utilized best. Our conventional medicine must always be used when we're looking at heart attacks, broken bones, trauma, acute illnesses. We need to be always looking at our conventional medicine for those diagnoses. And then we are going to take a look at our functional medicine. So when we're going to go back to some of those symptoms, and when we look at these chronic conditions and the recurrent conditions, long-lasting symptoms, we're looking a lot at those syndromes, right? So think of those syndromes for IBS, irritable bowel syndrome, right? Metabolic syndrome, polycystic ovarian syndrome, okay? So if you look here, you can see 12 of the most common disorders for which patients come into the practice to be able to seek care. Once again, metabolic syndrome, irritable bowel syndrome, chronic pain, PCOS, chronic fatigue, cognitive dysfunction, sleep apnea, depression. How many of you have seen a patient like this within the past week? How about yesterday? So how are we going to do this? Well, here is your systems-based biology functional medicine application. Don't worry, deep breath. In and out, okay? All right. So what we're going to look at here, we're just going to point out this interconnected, and what I really want you to see is this is an interconnected web. Every arrow leads to every other arrow, okay? So this is that holism. That's looking at everything being interconnected. So at the top, we have our environmental inputs like our diet, nutrition, exercise, and trauma up here. At the bottom, we have our mind, spirit, emotions, and community. But on the sides, we're taking a look at our immune and inflammatory balance over here, our gastrointestinal status, and structural integrity. Here we have oxidative stress and energy production, detoxification, hormones, and neurotransmitters, okay? We're basically going to stick with these 6. Today we're going to focus on oxidative stress and energy production. So let's think about this for just a moment. We are making energy. Energy is ATP. We're going to talk about that a little bit today. And if we don't have enough energy or ATP, then we're not going to be able to make our hormones or neurotransmitters. Let's call it our neurotransmitters for a moment, our serotonin or norepinephrine and dopamine. So then it's going to affect our emotional state, correct? Which might then affect our nutrition, right? So if our nutrition is poor, it's going to affect our detoxification, right? So do you see how this can be a little bit of a balance? It's going to just kind of ping pong all over the place until we can start at one place, get that leveled out a little bit, and then move on to the next. So Dr. Aviva Ram put it very well. She wrote, functional medicine views pathophysiology as not just a random occurrence or isolated organ event, but as a result of disruption in this interconnected web. Okay, so that sounded complicated, okay? We're going to make it much simpler. It comes down to 2 things. What's causing an overload and needs to be removed? What's missing and needs to be replaced? Okay? So this is my daughter. She, for her science fair this last year, did the Flint water crisis and what lead does to the body. She is the world's biggest advocate for clean water accessibility for everyone. And when you look at, I just wanted to use this because lead toxicity, we can see that in Michigan how? Flint, right? Who takes care of hunters? What about all of the bullets that hunting season's starting? What about people reloading, making their own bullets? So what are some of our symptoms of lead toxicity? GI upset, fatigue, peripheral neuropathy, but you might investigate for other disease states and find their testing is negative, so we need to consider other alternatives, right? So these are areas of assessment. As I said, we're going to focus on this energy and regulation and mitochondrial function here. These are the areas that you would find if you look at the Institute for Functional Medicine matrix, which I have a copy for you, okay? It's in these notes, and I'll have those on that website as well. Each one of these are those different nodes or areas of assessment, and you can read through these as well. So when we're talking about energy, what we're looking at is, I want you to start from right over here, and you can look along, but we're going to take it slowly. First, we have maximum wellness, okay? Then we end up with biochemical dysfunction, then symptomatic dysfunction, then a diagnosis of disease, irreversible degeneration, disability, and then death, okay? Dr. David Hasse, he's from IFM as well, writes, the loss of electrical potential across the mitochondria and cell membranes distinguishes being alive from being dead. And there is nothing that is more impactful than that. So here are some energy-dependent clinical scenarios, okay? So depression, headaches, fatigue, neurodegeneration, centralized pain. How many of you have seen a patient with one of these this week? How about yesterday? So here we are, friends. Here's mitochondria. We're going to talk a little bit about mitochondria, but not everything that it does. One thing you might not be aware of about mitochondria is that there are different concentrations of mitochondria in different cell types around the body. So different cell types that require more energy production, that have more tasks to perform or more complexities within them, are going to have a greater concentration of mitochondria. So that's one part of mitochondria. We're going to focus on the electron transport chain today, but we're not going to go through all the ins and outs, and there is no test, okay? But we're going to talk a little bit about the components involved with the electron transport chain. So when we look at the electron transport chain, what we're looking at is here we can see at the bottom, the mitochondrial matrix is at the bottom. This is the inner membrane. Here is the inner membrane, and up above, that's the inner membrane space. And what we're looking at are these group of complexes right through here, 1 through 5. And what's happening is we are forming a proton gradient. We're moving along protons, pumping them out into the intermembrane space so they can get to complex 5. And then that protein gradient is the energy that pushes through complex 5 in order to make ATP. Remember our ATP molecule? Okay, that is our energy right there. Here at the end is magnesium, and in this case, magnesium acts as a salt to stabilize ATP. Without appropriate magnesium, then that ATP will disassociate. All that work will have been for nothing, okay? 87% of the population in the US right now is magnesium deficient, okay? So appropriate testing is RBC magnesium. Nobody seems to run it, but I didn't know that. I don't expect anyone else to know that. So we want to take a look at that and keep that in mind with magnesium. What are our symptoms of magnesium deficiency? Well, this is Robert. This is my other kid. He did, I have 11-year-old twins. Those are my twins. He did magnesium deficiency for his science fair project. And he basically put together all of the symptoms. And he would come home and say, Mom, so-and-so has depression. I think you need to talk to his mom about taking some magnesium. And then he'd say, Mom, so-and-so gets really tired really fast when he runs. I think you need to talk to his mom about taking some magnesium. So you may or may not enjoy living at my house, okay? So this is something that's very important to think about is our magnesium deficiency possibilities. I'm going to go back to our electron transport chain because there's something else I want you to consider within our mitochondria. I want you to consider our electron transport chain is occurring in our mitochondria, which is basically a little factory of ATP production, and it's enclosed within itself, within the mitochondrial membrane, okay? Whenever we have a factory, what happens? It has byproducts of waste, right? And in this case, what we end up with are reactive oxygen species or free radicals, okay? So what we need, it's all enclosed within its own self, within the mitochondria. So when we end up with any kind of an overload of toxins, what happens in our factory? The wheels get gunked up, the mechanisms and the machinery doesn't work right, so it's slower. And then we can't produce our ATP as efficiently. So what we need to make sure of is that we can detoxify that toxic environment, and we do that with antioxidants, okay? So we need to have appropriate antioxidants truly getting in our system so that we can detoxify our environment. I want you to look at these circles here. They're niacin, riboflavin, CoQ10, fatty acids, carnitine, vitamin K1, vitamin C, lipoic acid, magnesium, okay? These are nutrients here that without appropriate nutrients, we are not able to utilize our mitochondrial electron transport chain well, and we will not be producing appropriate ATP. So this is progressive bioenergetic decline. When we end up with progressive bioenergetic decline, we end up with immunological disease, cancer, metabolic disease, aging, degenerative disease. So here are our thoughts on energy. Organized energy is the foundation of function. Disorganized energy is the foundation of disease. Restoration of the organization of energy is our goal. So how do we do that? So food is our energy. I know those people that know of functional medicine, a lot of people think, you're just going to say eat right. You're just going to say take your vitamins. And the truth is eat right and take your vitamins, okay? So when we're looking at food being energy, we definitely see that it works in the electron transport chain, but another mechanism of our or in the mitochondria in the electron transport chain is to collect the energy from the broken covalent bonds from our macronutrients, so from our carbohydrates, fats, proteins. So we need to make sure we have appropriate nutrition as well in that regard. Here's a list of conditionally essential inputs for you, okay? So you can take a look here. This is not an exhaustive list, but there are a number of inputs here that you can look at and say, oh my gosh, I really need, what do you mean DHA? I knew I should have DHA, but I'm not really taking my DHA. Maybe we need to consider these, okay? Whether it's nutritionally or supplementally. And here is some key nutrients for the different areas within the mitochondria as well. So the question then is, what are we going to do? Do we supplement these nutrients? Do we not supplement these nutrients? And this is where you need to meet your patient at their own, where they are. So if you have someone who walks in and they're very healthy, they eat a good diet, they've tried, paleo, and they've tried low FODMAP, and they've tried, Atkins or whatever is out there, and they're willing to stick with it, you can go with their diet and their nutrition. You just need to know what you need to make sure is in there and give them an appropriate dietary plan. We should be eating a rainbow every day, right? So every color of the rainbow, however we can get that in, that's what we're supposed to be doing. 5 colors of beige does not count as 5 different colors of food, no matter how much we might like that to be the case. So then if somebody walks in and they've got their fast food bag in their hands, or they've got their big, cup from 7-Eleven with whatever in it, they may need to consider the supplements if they're not willing to do the work when it comes to nutrition. How many of you have the patient that says, oh, well, but I just don't like vegetables? Yes, okay, so we're going to have to probably help them along with some of these supplements then and knowing the right things for them. So the other thing to think about is, what if somebody is extremely ill? If somebody is extremely ill, if somebody is on prescriptive medications, they're not acutely ill, they're not in any immediate danger, then you may need to also, even if they're willing to change their food and dietary, you may also need to supplement for that population as well, depending on their presentation. So let's look at our tree again. Now what do we think? Are we getting it a little bit more? We're looking at these underlying issues, our nutrient deficiencies. If that happens, then we're not putting enough in our soil, remember? We need to make sure our soil has everything it needs so that anything that is deficient is replaced, correct? And if there's anything toxic in here, we need to eliminate it, right? So our tree can grow nice and healthy and strong. How do we do that? So this is the go-to-it heuristic, okay? So the first thing we're gonna do is we're gonna gather ourselves in the information. And gathering comes in a lot of ways. The first way is make sure you are put together before you walk in that patient room. You know who you're talking to, you know what you're going in for. You sit with them, and if you gather if you already have information, you're going to gather that information and present it back to them. If you're taking a history, then you're going to be gathering that at the time. The next thing you're going to do when you gather that information, when you do the timeline, which I will show you here, is you're going to repeat that story back to them. You're going to say, I see that when you were young, you were hospitalized for 7 days. And then when you were 10 years old, you were hospitalized for 7 days. And then when you were 12, your grandmother passed away and she had been taking care of you. Because there are a lot of different aspects to health that we need to consider, okay? Then the next thing we're going to do is do an order of priorities. And what is the first thing that we want to do? We're going to rule out the acute. We're going to go back to our conventional medicine. We're going to make sure there isn't a problem here that needs to be addressed immediately, okay? Or not in this functional medicine fashion. So you're going to do your same diagnostic testing that you've already been doing in order to rule out an acute process. Once we've ruled out that acute process, now we can get to the business of working on their chronic disease state. And then we're going to initiate our assessment and care plan with the patient's thought of their limitations. What are they willing to do? What are they not willing to do? And then you're going to track their progress. I have people that come back and they say, yeah, I just couldn't do it, whatever that is. Couldn't take the vitamin, couldn't follow the diet, couldn't take 10 minutes for themselves every day, couldn't, find extra help for the children, couldn't do it. And I find that as well. So then we're going to work on something else. Okay, if that's not where we can find change, let's find another place to find change, because everybody has a place we can find change. We can find even the slightest change is going to make a difference. So we need to find where that is and where that patient is at. So when we're taking that history, this is back to gather. The first thing you're going to ask that patient is, when is the last time that you recall feeling healthy? Don't do that right now, but I recommend that you all do that later today. I see a smile out there. What you should do is sit down by yourself and think to yourself, when did I feel healthy last, really? When was I well rested and I could take a deep breath of air? When did I feel fully alive? And you'd be surprised, it's pretty far back there. I was surprised when I did that for myself. So it's the first thing you want to ask them. And then you're going to collect some information. Your antecedent factors, these are your genetic or acquired factors. And these are going to predispose you to an illness or a pattern. We know some of those things, what they could be, already from our conventional medicine. Then we're going to look at our mediators and perpetuators. And these are factors that contribute to pathological changes and their chronic long-term exposures. So this could be long-term exposure to poor nutrition, or it could be long-term exposure to a person in your life that is toxic and shouldn't be there, okay? Or it could be grad school, okay? So then what we're going to look at are the triggers that are provoking symptoms and signs of illness. These are acute events. This is the loss of a loved one. This is a hospitalization. So what you will find when you do this timeline for these patients is that you're going to find that they have these long-lasting, low-grade, chronic situations, and then there are triggering events along the way that knock them down. And then the disease state starts. And you can really follow that and track it, and that's how you can really find where those people are and how you can help them. Here's a functional medicine timeline. So you can print these out. These are for IFM as well. You can print these out. You can write them. There are EMRs that have this now as well. And so you can see over on the far left, there's the antecedents. And so there's preconception and prenatal. So mom's health state when she was pregnant with you. This is your genetic predisposition as well. Along the top, you have your mediators and perpetuators. So those are the long-lasting chronic stressors. And then there's the triggers or triggering events here. And then you put all of their health complaints along this timeline right here. And you can write along this way, signs, symptoms, or diseases reported. Then if you need 2 sheets of paper, sometimes you need to add another sheet, okay? And you can always, if you have the EMR system, you can always put this in an EMR system. So this is the matrix. So I'm going to come over here. Retelling the story over here. Remember, we're going to talk to the patient and retell their story. So here are the antecedents, the triggers, the mediators. And there in the center, there's our functional medicine matrix. Here is energy over there, okay, right here. And then around here, you can see structural integrity, assimilation, communication, all of the things we were already talking about, these areas of assessment, okay? When you learn about functional medicine, you learn what symptoms fit into which areas of assessment, okay? And then some of them overlap. You can end up with fatigue in more than one of these. Fatigue can be energy, fatigue can also be assimilation. So you can have them in different areas. And then what you do is you take a look at it and you say, where's the ink? Where did I put the most symptoms? Where is that patient? What node, what area of assessment do I need to start at in order to make this patient start feeling better faster, okay? Along the bottom here are modifiable personal lifestyle factors, okay? So it's sleep and relaxation, exercise and movement, nutrition, stress, and relationships, okay? So who enjoyed the first 2 lectures today? Weren't they great? Oh, they were remarkable. I loved every minute. And this just, I'm so glad for the turnout today too, everyone. I'm so glad you came because I feel like this ties in so closely to everything that they talked about this morning. So when we're looking at sleep, exercise, eat right, what are we really saying when we're looking at the biochemical model? We're saying you need to sleep and you need to exercise and you need to eat right. Right? And we're looking at all of that biochemistry underlying to prove that to be so, okay? This center here is also our mental, emotional, and spiritual. And this also is interconnected. So let's talk about those for a moment, our mental, spiritual, and emotional inputs. So we all know that our emotional state, our mental health affects our physical health. Numerous studies, we've all read them, we've all seen it in practice, we've all had conversations about this. So let's think about this biochemically on just 1 or 2 instances. So let's think about our emotional health or our mental health and if we have depression or anxiety, okay? So then what happens? Our body burns our B vitamins so that we can make, because they're precursors to help make our serotonin, norepinephrine, and dopamine. So we're burning through those B vitamins. So what happens if we don't have those B vitamins present? So our nutrition can actually affect our mental, emotional, and spiritual health, but our emotional and mental and spiritual health can also affect our nutrition because it can deplete that necessary element or those necessary elements that we need for other systems to function optimally, correct? Okay, so let's talk for a minute about cortisol. They mentioned that this morning. So when we look at cortisol, we're all on this fight or flight. We're talking about epinephrine, norepinephrine, cortisol. But cortisol specifically is on the steroidogenesis pathway, okay? So we have cholesterol coming in at the top, okay? When we have to make our cortisol, that cholesterol is called into action. It makes pregnenolone, okay? Pregnenolone has 2 choices now. It's either going to make your sex steroids or it's going to make cortisol, okay? So that's it. So pregnenolone is limited, which then can go to cortisol or it can go to our sex steroids. Which is more important to our body, to live or to reproduce? To live, right? So our body preferentially chooses to make the cortisol as opposed to making the sex hormones. So now what happens when our sex hormones aren't made? What are those symptoms? Decreased libido, brain fog, irritability, depression. So when we are now making our cortisol is higher, okay? Now, I want to say something that's very interesting here though. Pregnenolone, let's go back to our pregnenolone. Where is pregnenolone made? It's made on the inner membrane of the mitochondria. Guys, so if we don't have appropriate support of our mitochondrial health, how are we going to support all of our mental, spiritual, and emotional function? Is this making some sense? We cannot discount the importance of this balance. And this is the hardest place to meet your patients because everybody is different and a lot of women, well, a lot of people, not just women, are coming in willing to do anything. I ate my vegetables, I ate my fruits, I got my sleep. I did this, I did that, I have my exercise. Why am I not better? And when they come in and they are so put together like that, this is where I know we have a problem. So then we have to address this, and this is a tough one. So here is an empty matrix. So this is one of those forms where what you can do is fill in. This is where all of your timeline comes together, and you fill in your antecedents, triggering events, mediators, your modifiable personal lifestyle factors. So these are the things, remember, that you're already doing, not the changes that we've made. You put in all of your symptoms, whether it's in the outer ring here or the inner ring, and then you ask yourself, where's the ink? What am I going to address first? And that's where you go. So in our functional medicine assessment, we're going to do our history and physical exam. We're going to order our diagnostic tests, and we're going to customize a wellness program. Okay? All you need to remember to ask yourself here is, what is causing an overload and needs to be removed? What is missing and needs to be replaced? Right? Remember to make it simple for yourselves. Here's the question, really. How do I have the time? And this is tough. I don't know. Okay? I'm working in a very busy OBGYN office. I put a functional medicine one at the end of one day, once per week, one functional medicine patient, because it takes a lot of time to put these people together, especially when you're an insurance-based model. A lot of the functional medicine providers, most of them are cash pay. You don't have to deal with insurance. You scale accordingly for prices so that you can utilize the time, because for every hour you spend helping a patient, you're usually in the very beginning spending an hour trying to figure out exactly what they need to do next, okay, while you're learning. And so it's hard to put it together. In an insurance-based model, if you decide to take something like this on, what you're going to need to do is really spend just a little bit of time with your patient saying, this isn't going to be all at one sitting, and it took a long time for you to get here. You're not going to get better very quickly. They have to understand chronic condition to get here. It takes a long time to repair. And also, if you only have 15 minutes, let's say you're doing a 15-minute appointment block, people have to understand you're going to be seeing me for 15 minutes every 2 weeks for the next 6 months or 3 months, or however long you decide in your practice that would make sense. Then you have them make those appointments all at once and tell them, you can make an appointment with me, you can cancel an appointment with me, but you can't necessarily make an appointment with me. So put them all in together, and then we will see you back and we'll do stepwise, okay? You get time to get your diagnostic testing done. They come back, you go over results. Some functional medicine providers use more testing. Some use less testing. Testing is also difficult because it's not usually paid for by insurance. And so this is complicated. You can go by symptoms alone when you do your matrix, and you can see how your patient is doing. And if your patient isn't doing well and you think, maybe I need to figure out something else, something's not going right here, you might require that testing is done. tell all of my functional medicine patients, if I had it my way, I'd spend $1,000 of your money on tests, just because I'd get the answers now. And that would be great. But we don't spend $1,000 of anybody's money. We start slowly, and we start with where they are. So that brings us to where I am, and this is my favorite thing to do. And this is helping women with pregnancy and pre-pregnancy care. So preconception, about 6 months prior, is where I'd like to have you. What we're asking is what? We're asking what is missing and needs to be replaced, and what is present that needs to be removed. So we can frequently get these women up to a dynamic state of health. Within our 6 months, they're ready to go. I have infertility patients who have been seen by specialists. I have infertility patients who have failed IVF. I have people that just needed this boost. If our body isn't doing it on its own, there might be some underlying condition why. And it might be functional. So we need to take a look at that. So detox, I wrote 6 months prior, or don't do it at all, because when we detoxify our system, we don't want to do it right before a baby's going to be in it, okay? So we want to make a nice, happy environment that a baby would love to grow in, okay? And so we want to make sure that we're not going to detox and don't have them detox when they're breastfeeding, okay? Our infertility rates are on the rise. It's, I believe, 23% increase in the last 10 years on infertility. So that's something that we can really look at our functional medicine for some answers. Also, those child chronic conditions are on the rise. Who sees kids here? Who's seeing more eczema, more allergies, more autism? Yeah. So basically, what we're looking at with mom is if we can optimize mom's nutrition and lifestyle. If I optimize even just mom's methylation alone, then that can positively impact the offspring for 2 generations, okay? That's something you can really grab a hold of, digest, and say we want to make change. I want to tell you about one patient of mine because she just had her baby. She's a breast cancer survivor. I think she's 38, although she'll kill me if I'm wrong. And she just had the healthiest baby boy. And she sent me a picture. We did 6 months of prep. And this was 2 years after treatment for her breast cancer. And she sent me a picture, and it said, of the baby on my phone, and it says, fruition of a functional approach. So this is my favorite thing right here, working in this area. So I did put together this website. It is not up yet. It'll be up in about 48 hours. This session will be recorded. I'm going to put future functional medicine proceedings on there as well. The slides from this presentation will also be on there, as well as I said, my colleague who put together, I think there's a small fee, but she put together all of the functional medicine education facilities that there are so that you can look at IFM, A4M, FMU, all of the different locations, and you can see what might fit for you for training. And I'm happy to take questions if anybody has any. Yes. I started with Functional Medicine University, which is FMU, and it's on your own. It's computer-based. You can get certified, I think, fairly quickly. I don't know. I didn't end up going through the whole thing. It's pretty inexpensive as far as functional medicine programs go, but I didn't feel like it had enough meat to it. So although they have great lectures and I still have access to it, they have great lectures on protocols. But they didn't give me the biochemistry that I needed for me. But my background's in biochemistry, so I needed something a little different than some people might. And so FMU is decent. They're all good, actually. They all are certification tracked. You do not need to be certified in functional medicine in order to practice functional medicine, period, okay? As a matter of fact, no matter what functional medicine program you choose, they strongly recommend you start practicing day 1, even if you only know a little tiny bit, okay? You just start applying it somewhere. And you can say, I don't know to patients. I say I don't know to patients all the time. So you can say, I don't know, I'm gonna have to look into that. Or, hey, I read about this thing, or I saw this great lecture, but I know nothing about it. I say that all the time, okay? Let me look into it, they say okay, and then we get back together and we figure out where to go. IFM, so Institute of Functional Medicine, and that's, I just completed all of their training. And they are biochemistry-based They are not as algorithm based, which is tough, because when you learn all of the science and then you telescope in and you look at all of the scientific terms and you look at all of the biochemistry and you learn it, and then you telescope back out and you say, okay, now what do I do? Okay, I think we find that a lot actually with PA and NP school as well. I think it would be great if they had more. They're working towards having more algorithms and plans of care. And then A4M is they're known as the anti-aging functional medicine. All functional medicine is anti-aging, right? We're looking to achieve that homeodynamic state of health, right? We're looking for that robustness, as we saw. So all of them are looking through that approach, but A4M is known for its doing the youthfulness. So I think it appeals to a lot of people who do a lot of derm and a lot of skincare and a lot of ortho. I think they like a lot of A4M. I'm going to my first A4M conference. I have a friend who won 2 tickets, so I'm going to my first one on December 15th. I'm super excited. So I can put something up about how that was and go from there. Yes? No, unfortunately, what's happening with me for infertility is, well, for all of functional medicine, is I don't have a lot of time. I've been in private practice for 16 years, just with traditional gynecology, so I don't have a lot of space in my practice anyway. And so what I do is I usually get them in, we talk about this. I first see if at a visit they're even interested. I just try to see if this is a path they even want to go down, because a lot of people aren't interested. They're just not there yet, or the depression is so deep, or they just can't do it anymore. And they've done it enough for long enough. They need a break from the whole infertility thing. And I say, I'm here when you're ready to give it another try. If you want to try things a little different, it's not standard of care, which I always document, that functional medicine is not the standard of care and informed consent has been obtained, okay? Because you have to do that. And then when they're ready, they come back and see me, and I'm excited. I like getting nutrition testing on them. I like to get stool tests a lot of the time, and then see if there's any underlying issue. We need to look at the gut a lot of the time because we have malabsorption. So if we don't look at our gut and we're eating, or we're looking at our nutrition, and then you have great nutrition coming into the body, and you check nutrition again and it's not getting in the body, we need to think malabsorption. Who has anyone on Prilosec out there? A PPI? Yes, I hear the laughter. Yes, I know, that's it. So, and there are other medications as well, and there are other situations that we can have malabsorption for. So I like to get it if I can. Usually patients have significant symptomatic relief once they've been on a specific nutrition or a supplement plan within 6 weeks. So I can have someone back in 6 weeks, and if they feel no different, I've got to get testing because I don't know where it's coming from. So I have to do that with them. What I am in the process of doing right now is building an online pre-pregnancy model. So hopefully that women can just go to, and I'm going to make it extremely simple and stepwise. This is how much water you need to drink. These are the foods you need to eat. I'm going to hopefully do some meditations. I'm doing meditations now with these women for that whole emotional, spiritual, mental place, and getting all of that online. I'll put that up here when I get it done also, so then it's not just a few of us out there trying to help optimize these women prior to conception. People are desperate and they really want this help. It's just how to get their hands on it. And as I said, Michigan is not really up and coming in the functional medicine game yet. I mean, down south, Arizona, Texas, Florida, there are a lot of different places where they are. We are not one of those locations as of yet, but I am seeing more of it show up. I've had a few people approach me today that are incorporating functional medicine. And 3 years ago, when I first went to IFM in 2015, no one was doing that here. I'm insurance-based, so the nice thing for where I am is I'm subspecialty, I'm OBGYN, and so in a subspecialty, you can bill based on time. where family practice you cannot. So if I spend 2 hours with a patient, and I spend 2 hours with a patient, not 50%, with face-to-face time, I spend 2 hours face-to-face with that patient, then I can bill it. I haven't gotten audited, we'll knock on some wood, but the truth is my documentation is ridiculous. Look at how I speak. And I dictate, and it is 2 pages long by the time it's done, So it's not so bad. What's hard as a provider is having the time to then review all the labs, figure out what you need to do next. How are you going to communicate with the patient? How are you going to get their buy-in? Because that's really it. How are you going to get them to understand this is a completely different way to look at medicine, right? So how are you going to explain to them? The truth is they're looking for it. They want the answers. So even if they don't understand, they will pretty much do, if you show them how it lays out, they'll pretty much do it if they can, or if it's not out of line with their belief system, or with, like a lot of people don't want to eat vegetables. Really, I don't know what to do, that's it. I give them green and red formulas that are powdered, that you can mix in. There are some that are really good that are not sweetened with sugar substitutes that aren't high sugar themselves. So, you can find a couple of those, and that's at least something, at least getting something in. But back to the point of, I charge by the hour or by the 15-minute, and I try not to kill myself on the weekends and still spend time with my family, which is hard. That's the nice thing about those lectures this morning on mindfulness and self-care. I'm a self-care person. When I went to my energy conference, it was August of 2017, it was 3 days, and they really focused on that mental, spiritual, emotional, and they had us meditating like 20 minutes 3 times a day. I never felt better in my life, and I thought, is there really something to this? And I meditate every day, every single day. On the break here, I stayed at the hotel last night. I went up to my room and I meditated because, 15 minutes this morning before the whole thing started wasn't enough for me. I meditate every single day. And if you find a way, and it doesn't have to be meditation, we're all going to do something right now. Put your feet flat on the floor, please, okay? So don't close your eyes yet, because first I'm going to tell you what we're going to do. First, breathe in through your nose. Kind of suspend your breath up like this. Exhale through your mouth. Okay, so that's what we're going to do. But while you do that, breathing in through your nose, you're going to suspend your breath for 2 seconds. You're going to inhale for 6 seconds. I'm going to count for you. You're going to suspend your breath for 2. You're going to exhale for 6. You're going to suspend your breath for 2. And you're going to keep going until I'm done counting, okay? I'm going to have you close your eyes now, and we're going to breathe in 1, 2, 3, 4, 5, 6. Hold, 2. Exhale, 2, 3, 4, 5, 6. Hold, 2. Inhale, 2, 3, 4, 5, 6. Hold, 2. Exhale, 2, 3, 4, 5, 6. Hold, 2. Inhale, 2, 3, 4, 5, 6. Hold, 2. Exhale, 2, 3, 4, 5, 6. Hold, 2. How do you feel? Not bad, right? So I want to tell you 2 things. 1, did you struggle at the top of that 6? Okay, all right, if you're struggling at the top of that 6, you are not breathing, friends. Okay, you're not. You need to be, my daughter timed me the other day on breathing, because I've been doing this now for over a year. I did 1 inspiration, suspension, and expiration, 52 seconds. She was like, I know, I was surprised, because you're not in the zone. You're not there, you're not with her when you're doing that. When you finally get to that spot of meditation, you're not suffering for breath, you're not counting. But I want to point out the other thing, when I'm counting for you, what are you not doing? Anything else. Thank you very much. That's exactly right. So when I have people and I have patients come in, and I do this 10 times every day. I spend these 2 minutes on this conversation because this is so valuable. I have patients coming in saying, I heard you in my head, Jessica. I'm like, that's right. You should hear me in your head. I'm saying good things to you. You know, so basically, when we aren't able to breathe up to that count of 6, then we're not breathing enough. We're shallow breathers. We're not able to achieve that nice deep breath. We need to achieve that nice deep breath to get into parasympathetic. So where you're breathing in for a count of 6, count for 2 for suspension, exhale for a count of 6, count for 2 for suspension. And do it until you're not thinking. If you find out that you're not counting and you're thinking, come back to counting, okay? After a while, you are no longer counting. You're breathing and you're not thinking. Isn't that amazing? And then you say, oh, that felt really good. That was like a full night's sleep. So then I'm gonna do it longer. I set my alarm now for about 5:15. I have to start making kid lunches about 6. I don't wake up, hit the ground running like this. Who wakes up with the alarm and says, okay, I gotta get this done, this done, this done, I have to be out the door by this? Yes, yes, okay. How many people at night before you go to bed say, okay, in the morning I gotta make sure I'm doing this, 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 right, okay? When did you ever get into your rest and digest? When did you ever relax and get into parasympathetic? I'm in parasympathetic every morning before anything else happens. And you know what? If those lunches aren't perfect that I make, so what? Okay? So find the things that you can eliminate and weed out. Breathe in and out. Take the time for yourself. This is very valuable. This helps you balance with your emotional and spiritual and mental health. Thanks so much for coming, everyone.